Hey there, and/or welcome back. So this week we'll go into a couple of signs of dehydration for your baby. So the very first sign from their little body would be what we call urine crystals. There are some other terms that someone may use, like kidney crystals or uric acid or crystallized urine or something like that. But essentially what it means is that when your baby passes urine, a little bit of orangish, reddish tinge will come out. And usually the parents think it's blood. So that's the phone call that we get. It's, oh, my baby's bleeding from the pee. So it's usually the crystallized urine. And that means that there's not enough urine in the kidneys to flush it all out. So they're dehydrated. So just like when we as adults go to the bathroom and our urine is extremely concentrated, like a dark, deep yellow, or there may be an odor to it of some sort, that's usually our sign that we know that we're dehydrated. So with their infant, it usually comes out as crystallized urine. And again, like I said, it'll just look like almost like what some people call it as brick dust, where if you can imagine if you were to take some bricks and bang them against each other, the little particles that come off, if you get them a little bit wet, form them into like a little bit of a paste. That's pretty much what it looks like. So at that point, it's not usually a sign or a cause of concern just yet. It's just that that's the baby's first way of saying, I need more fluids in me. So if it's a breastfeeding mama, then we may start to encourage mom to nurse more frequently, or maybe nurse a little extra time during each session, and by all means for mom to start drinking more water, because if mom's not properly hydrated, you won't be able to hydrate your baby. The other thing that we will look for as staff, whether it's the nurses or the doctors, are the mucous membranes. So usually if I put a glove on my hand and I slide my hand in your baby's mouth, if I meet friction, like I can't slide my finger in the baby's mouth, that's because the mucous membranes are really dry and it's not allowing my finger to just slip in. So if we see that, then we know that, or if we just look and it looks like the baby's tongue or the inside of the lip looks dry, then we will say that the mucous membranes are dried out and baby does need more fluids. The other thing is we always look at fontanelles. Some people call it the soft spot. So on the top of the head, if it looks like a dip in that soft spot area, that means that the fontanelles have sunken in, and that's another sign of dehydration. It should always be flat. You should only be able to feel it. You should never be able to see it. So if you can see it and it is visibly a sunken in area, then that's a sign of dehydration and baby needs more to drink. So before it gets to that though, the doctor or the pediatrician should be looking at weight loss versus weight gain and things like that. If baby is a breastfed baby and you notice that all of a sudden they just will not stay asleep, you put them to breast, you try to nurse them and they just wake up screaming, and you put them right back to breast, and maybe they calm down for a few minutes and they may even drift off to sleep. But as soon as you try to settle them in their crib or their own sleeping space and they start shrieking again, that's usually because you don't have enough let down, meaning that you're not supplying enough milk for baby that baby wants. So some people will call it cluster feeding, but it's really just that baby is quite literally demanding more. So you do want to listen to baby. Might want to start pumping, might want to look into donor milk, or if you're okay with it, look into some formula at that point. The best way that we send parents home to know that their baby is properly hydrated is the number of voids. So for the day of life, baby is up until a week, they should be having that many voids per day. So if baby's 2 days old, they should be peeing twice a day. 3 days, 3 times a day of urine. Then when they're about a week old, it should average out to about 6 to 8 times a day. Baby's not peeing enough, baby's not drinking enough. So simple as that. Hope you guys learned something from this week's video. That lets me know that I've done my job. See you next week.